Show of hands, how many of you were working with or living with diabetes in 1999? You know what, we should probably wait to ask questions till after my talk. Now, I was told this is of course, this is a very seasoned professional audience. Yeah. And, you know, not surprisingly, most of us have been in the field for over 20 years. So hopefully this is going to be a fun look back to the state of affairs of diabetes, to when we were partying like it was 1999, because it was. Do you remember where you were when the diagnostic glucose value was lowered from 140 to 126, and everybody's scrambling to change all the education materials? And what about when we got Lantus, the new basal insulin, and the animal insulins went on their way out? No more pork and beef. And what about the new classification of pills called TZDs? Good thing for the initials, because I have a hard time pronouncing Thiazola Dionne Warwick. You know, I'm a big fan of her. She's got a new album. I highly recommend it. And then, can you believe it was only 20 years ago that we got our first continuous glucose monitor, but that it was blinded to the individual wearing the device, and it could only be used in a physician's office and only for 3 days, because we didn't quite know what they might do with the data. We weren't really sure. Remember that? We've come a long way, and we really have a long way to go, I would argue, but I think it's fun to look back. But what about some of your esteemed speakers? Beverly Tomasian had just recently launched her diabetes education services business. And now look at her. This is her dream child. So please, let's give it up for Beverly. Nicole Johnson, who will be joining us later, are you here, Nicole? Hello, Nicole. Welcome. Nicole, come on in. Don't feel pressure. Nicole, in 1999, had just received Miss America. Yay. And yours truly was a new diabetes educator, having worked just long enough to get off new hire probation. So it was time to tear off that nasty diabetes complications poster that dawned my office door for all those months. It was a medical illustration showing the eyes going blind, the heart having had a heart attack, the kidneys failing, and for goodness sake, a toe starting to rot. It still angers me to this day. Do you remember the one? Yeah. I imagine, what would it be like for somebody with diabetes, whether newly diagnosed or coming in for a tune-up, rounding the corner to be faced with their worst nightmare? Me. No, to see in a very visual, graphic way what could go wrong. And you know, that nasty poster really, I don't know, it inspired me to look at things a different way. And I started to ask the question about, what do people see visually with diabetes? And how does that impact them emotionally? And I would argue that our education materials fell shy of inspiration, and certainly weren't fun in any way. And I know that you are all inspired by things that happen in your career, things that go above and beyond your regular role or your job description. And you do something about it because you know that it's going to make it a better place for people with or at risk for diabetes. Now, I'd like to share a few examples from my career, things I did above and beyond my role, and I invite you to do the same. In your packet, there's a worksheet where you can reflect back to 20 years ago and 10 years ago, and then we'll look forward from 10 years from now. And then I hope that you'll share during our break so that we can collaborate and discuss what we each did. But before I jump into that, I want to ask you, how many more people with or at risk for diabetes do you think you could reach by tapping into your creativity? The first example I want to share with you had to do with that nasty diabetes complications poster. It really inspired me to think about how we could do things differently. And I know you have these moments where you're like, yeah, something could change with this. And what I started to appreciate was that our messages were just a little bit too serious. And that seriousness was not in my nature. I was raised in a very humorous environment with a family that tended to laugh a little bit too much at a lot of things that weren't necessarily appropriate. But meanwhile, back at work, people with diabetes would comment on my sense of humor. As did my mentor, Annette McElroy, from Community Hospital of the Monterey Peninsula. She was a nurse and a diabetes educator. I see my Monterey peeps over here. Hello, Monterey in the house. And she was the editor-in-chief of our nursing journal at the hospital. And one day she said, you know what? You're funny. Why don't you draw some of the funny things that come out of your mouth to break up the copy space? And right away I was transported back to when I was 7 years old, and I remembered I wanted to be a cartoonist. And I had entered a Highlights magazine contest. You remember that? You took that too? Did you get the rejection letter from Walt Disney? I did. I was waiting by the mailbox every day with bated breath. I'm going to get the letter, like an Acme, like one of those little cartoons. Well, I put the letter, where's the, no feedback. So I finally get the letter 2 years later. Great way for feedback when you're a 7-year-old. So what did I do with that letter? The same thing I did with the poster. Whoosh, threw that away. And frankly, I was kind of pissed, Come on, you're going to wait this long? But you never know. You never know what somebody is going to say that will inspire you. And because of Annette's question about, too bad you can't draw something funny, it was like, it transported me. And then what ended up happening is I remembered this vision. I wanted to be a cartoonist. And then I started to draw some of the funny things that people would say in our clinical encounters. And I became a cartoonist. I published many cartoons. Polite laugh from the audience, thank you. This is very good, I'll pay you later. Yeah, so the top, as some of you may not be able, the top one is a farmer's market, and the comment is, as they say, when life gives you lemons, make lemonade, and the other gal says, yeah, too bad life gave me celery. And here's the pear shape. The dietitians will appreciate the pear shape, the apple shape, and then an apple core, and they're asking, what, have you been working out? And then, hey man, we're in San Francisco, the summer of love, the summer of Atlantis, and they're there with their insulin bottles. It's kind of hard to see with a guitar. And the woman's saying, hey man, insulin is groovy, trying to change the myth about insulin. And then the last panel is a mom with her son who has hurled his insulin pump through insulin security, saying, my insulin pump made it through security. So these are just a couple of examples from a breadth of work using therapeutic humor, which I understood from the literature really helps with coping. Not that there is anything funny about having diabetes, but people really responded well to seeing this instead of that poster on my wall. And I went on to be a regular cartoonist for several websites and the Diabetes Interview magazine. Remember that gem of an oversized magazine? And we didn't know what to do with it because it was kind of big and it didn't quite fit in with any of the other magazines. And then I ended up publishing self-publishing a diabetes cartoon book. And 7 years later, I was Miss Educator of the Year, but unlike Nicole, I didn't get a crown or any flowers. I'm just saying. No crown. But that's okay. The American Diabetes Association published 2 books I authored and illustrated. And my cartoons have been translated into several languages. Suffice to say, my cartoons have reached thousands of people that I wouldn't have reached otherwise if it wasn't for tapping into my creativity. The second example I want to share is this one pulls at my heartstrings because it involves dance. And so I have to tell you, one AADE, or the American Association of Diabetes Educator Conference in 2007, I had won a little iPod Shuffle, back when our music was not on our phone. And I stuffed it full of all of the favorite dance tunes. And every morning I'd be dancing, like this morning. I just love to dance. So I put on my little earphones and I'm dancing, and it's like, oh, I have to go to my other love. the love of working with people with diabetes. And I'm like, I'm gonna be late again. It was okay, I was a manager, so I could like roll in late. I know, privilege, the manager privilege. So that was when the idea was sparked to combine my two loves of dance and diabetes, and the nonprofit Dance Out Diabetes was born. We brought the clinic to the dance floor in a monthly intervention where we did a cultural odyssey of dance, everything from hip hop to hot hula to belly dancing and dancing to Michael Jackson's Thriller and even odd things like the tarantella for the Italians in the audience.
Are you still doing it?
Unfortunately, I'm not still doing it after 5 years of running this. It was a little bit much on top of a full-time job, you think. So sadly, it couldn't continue. We measured health metrics, so we did A1C, blood pressure, pre and post dance glucose, weight and waist circumference, and we measured like sense of joy and how often people took their medication. I mean, we measured all kinds of stuff. And we did publish an abstract at the American Diabetes Association scientific sessions, but I'll never forget one dance in particular, because we invited everyone. The whole thing was, you know what, let's stop paying lip service to exercise. I wanted to do something about it. Yeah. I wanted to bring people together to prevent and manage diabetes and provide ongoing support. And it didn't matter. You were welcome if you had type 1, you had type 2, you had pre-diabetes, you had gestational diabetes, you had LADA, and family and friends, because this is not just about a glucose, right? This is about support. So it was just such a great melting pot. And one dance in particular, we had a 1.5-year-old on his throw blanket next to his mom, who was getting her groove on, next to a 95-year-old woman who was shaking her bonbon in the midst of everyone else just having a blast. And I know that here in San Francisco, it's reached over 1,000 people. And with our YouTube videos, we've reached over 50,000 people. So again, this was an example of what to do when you see an issue and you see, maybe there's something we could do about this. So I'll always have fondness in my heart for Dance Out Diabetes. The next example I'd like to share occurred also here in San Francisco after attending the American Diabetes Association postgraduate course. And there was a lecture on polycystic ovarian syndrome, or PCOS. And at that time, the lecturer went on and on about, we really need to screen the daughters of the mothers who have PCOS for diabetes. Like, hey, I'm all for it. Let's prevent diabetes. But I'm secretly thinking, hey, wait a minute. What about the group that has the highest rate of PCOS of all women? And that's lesbians. She never mentioned it. So I thought, that's odd. So I waited, and during the question and answer period, I go up to the mic and I ask her, are you familiar with Agarwal's work that shows lesbians have the highest rates of PCOS of everyone? To which she responded, yes. I couldn't believe it. How could somebody knowingly withhold information about a vulnerable population that is doomed to get type 2 and not share it? So I got home. I'm a little upset now, I'm almost shaking. So I got home, I calmed down, I wrote her a very nice letter a few weeks later. Never heard a response. And I thought, you know what else is missing from the mainstream world of diabetes that we don't know about the sexual minority? And I combed through the literature and was really taken aback by all of the links that the sexual minority has that are unique when compared to heterosexual counterparts. So during this time, I get a call from Diabetes Spectrum, and they ask me, hey, would you like to write a manuscript? What do you think? What do you want to write about? I'm like, this is perfect. Said, I would like to write about providing LGBT culturally sensitive diabetes education and care. To which she said, what's LGBT? And I was like, oh, I thought everybody knew that meant lettuce, bacon, tomato, and gorgonzola sandwich. No, I explained what it was. And she was really open to the idea. And it was published, and I know that it has reached thousands. That's her now. I
just texted two of my friends who needed to be here. They should be here. And they just said, gee, it looks great. I wish we were there. So.
Wish her friends wish that, I'm so glad you're here, though. The important people made it. So I speak about this internationally because it's important. The sexual minority are in every race, every culture, have every kind of diabetes, and deserve our expertise. And I just know that it's reached thousands, and it was because of attending a conference and kind of asking a question, something doesn't seem quite right here. Anyway, the last example is probably it is my most exciting and arguably the most personal. And it starts with everything that starts, hopefully, with the mothership. It starts with mom. So I would like to introduce you to my mom, Annie Garnero. Now, it's kind of hard to see, and I look completely sunburned, like I've been weeks in Hawaii with this image here. But don't worry, all roads lead to diabetes. We'll get there. And Mom, I was honored to walk with her in her last year dealing with cancer. And during that time, I would show up and I would really try to dress well because she was a fashionista. And it would be remarkable how we would be dressed in these same outfits. Just really funny. And you know how it is. Several of you have already been a caregiver for someone. And you know how it is. You hold it together during the day. But at night, that's when you kind of can fall apart. And guess what was waiting for me at night when I got home? Klondike bars. That's right, Klondike bars helped me cope with my mom dying from cancer. Now there's a Mother's Day ad no one's thought of. I would have 1 or 2 Klondike bars a night, and all the dietitians were like, eating disorder alert. Yeah, I'll give you that. And it also gave me a lot of extra weight, and not surprisingly, I was diagnosed with prediabetes 2 years ago. And I have to say that my BMI wasn't quite high enough to qualify me for a CDC-recognized National Diabetes Prevention Program, or DPP. And even if it did, I had some barriers to attending the 26 appointments over the course of a year. Like, what's funny about that? I want to prevent type 2. That wasn't intended to be a joke, but I thank you for the laughs. I love it. You can just keep... Yeah, I mean, I didn't have it like other people with prediabetes. I didn't have insurance at the time, and my schedule was really hectic. But more importantly, I really had a lot of shame around this. I mean, come on. I'm a diabetes prevention lifestyle coach, and I couldn't stop at Klondike bar number 734? So, yeah, I really blame myself for getting prediabetes. And I think that that sense of shame is a common shared experience amongst people with prediabetes and diabetes, and I think the use of language has a lot to do with it. So I went online to try to find an online course because I needed a little nudge, and I was surprised to not find anything. And how could that be? We have over 84 million people with prediabetes, but did you know that less than 2.5% report ever having attended a year-long lifestyle intervention program? That was according to a recent publication this year from the Journal of Preventive Medicine using the 2016 data from the National Health Interview Survey. Granted, that was from one report 3 years ago, and maybe those stats have quadrupled, and let's say we've reached 1 million people now because of the fine work that the CDC is doing to help prevent and delay type 2. That still means we are not reaching 83 million people. We can and we must do better than this. I mean, according to this report, we only reached like 200,000 people. Are we barely even scraping the tip of the iceberg? So I think we can do better than this because the tsunami of people getting type 2 is only picking up speed. And it just sparked the idea for me, I'm lucky. I have professional resources. I did the work. I lost the weight. I got to a safe place. But what about all the underserved areas and people who can attend a program, who don't have a program locally, who can't afford an online option because less than 1% of maybe, is it 1,800 programs now that are recognized nationally, maybe more. You'll hear about that from the gifted Dr. Ann Albright this afternoon. Less than 1% are all online and available to the public. And of those, they're not, I mean, they're expensive if you're paying out of pocket. Some charge upwards of $1,000. So I was thinking maybe I could build, maybe I could build an online pre-diabetes prevention program direct to consumer. That was a journey I started 1.5 years ago, and oh my, I had no idea the energy it would take. So basically, I've been working, and I'm launching today, and you guys get to be the first to jump on. I invite you. In your packet, there's an access code if you're so willing to collaborate. And the point of this here is to share creativity. So if you don't want to jump online and give me your feedback to what I've done for the first month of the program, that's fine. The concept for the Sweet People Club, it's sweet because if your sugar's high, we're a little sweet. And it's sweet to be part of a community who is trying to work on their health together. So it's an all video and audio program with transcripts, and right now working with KingFit to translate it into Spanish. And I'd like to give you an example of 1 minute of what this looks like, but you can see more online. Sometimes that's a fun way to discover new food, involve those around you to help you cook, save you time, and find other ways to eat healthy. How about the challenge, I don't like the way this food tastes? Okay, here are some solutions that you might be able to try. Change your favorite dishes to make them healthier. Choose good quality items. It's amazing how tasty food from the farmer's market tastes as you get it super fresh. Sometimes the food in the supermarket has already gone through 2 distributors before it gets there. Choose items with a variety of flavors, textures, scents, and colors. Cook veggies like green beans and broccoli lightly so they stay crisp and colorful. Dress your food up with herbs, spices, and low-fat salad dressing or lemon juice, vinegar, hot sauce, plain non-fat yogurt, and salsa. And what about the yummy flavors when you grill or roast veggies or meat to bring out the flavor? Okay, so that gives you an idea, a little sampling. Thank you. Wow, all this applause. I love it. So, the point is to collaborate. We have a lot of brain power here, and it was just an idea. Is it valid? I don't know. I haven't tested it. Certainly it's using the CDC program, but I would love your input. But I now want to thank you for listening to my 4 examples of how I use creativity to reach more people. And I want to ask you, what are you going to be doing in 2029? That's when Tracy Brown will be our president. Hey, and who said retired and in Tahiti? No. We have a pandemic here. Well, you can invite some of us to come and take a break. Because I think it's through the efforts that we make to reach more people that we can make a big impact. And so I invite you to reflect and dig deep. What is one way you can use your creativity to affect even one more person with or at risk for diabetes? Because it's through helping that one individual and their family and their community that we do our best work to keep diabetes in a safe place given this pandemic. And if you look around this room, we have the talents to reach millions of people. So I look forward to this afternoon when we collaborate and look at what we hope to accomplish in the next 10 years. So what do you say? Let's do this. Thank you.